Most of us like to focus on the delivery system, the patient, the clinical. So when I talk about the delivery system, I'm really talking about the whole range of it. Taking the patient's perspective and saying, what's it like for me to try to get an appointment? What's it like for me to show up to that appointment? What's it like? How am I treated in that appointment? But the way that I allow you to schedule your visits for your doctors or for radiology or for the laboratory is as important from the patient's perspective as it is for whether or not when they receive their bill, if it makes sense, if it's correct, if it's one bill, if it's promptly delivered to them via text so that they can execute it on it right away. So for me, it's all about taking what could be a best practice theoretically, and then thinking about how you apply that in a really, really complicated delivery system, a really complicated environment, which we refer to as the real world. I think that the only way to do it right is to have deep discussion with people that have complementary skill sets. You need to have the people that understand how to think creatively about a payment solution or a delivery system solution. You need to have the folks that know how to implement that. You need to design it in a way that allows for program evaluation at the end so that you can decide if what you did was good or not good. And then you need to have the leadership needs to decide to shut things down that don't work or to amplify things that do work. We talk about this as a learning health system at Mount Sinai, and we are not perfect all the time, but we're trying really hard to be thoughtful about taking what we think might be a best practice, implementing it, measuring it, and then revisiting it and to decide whether or not we're going to keep it going or whether or not we are going to try something new.